Thanks, Wayne, and thank you for the opportunity. Whoops, I got to get on my X since I'm a TED Talker. Thank you all for the opportunity to present to you today. Thanks to the board members of ACH who are here today and supporting the organization all year round. And it is really a great opportunity to learn what you're doing here in Texas and to see if I can sharpen my skills to quickly give you some ideas that might be useful for you, if not today or the days before Thanksgiving, but certainly to implement before the new year. So I'm being facetious there. I hope you understand. I didn't hear any laughs, so hopefully I won't keep swinging at pitches that I can't hit. So I want to talk about placement changes. This is a topic that has been a topic in child welfare services as long as it has existed. The very first book I think ever written about child welfare services in the way that we know it in 1959 focused especially on the instability of kids in foster care. And we have improved many things since then, but we certainly have a ways to go. After I talk a bit about a study that I was involved with for multiple years, a big national probability study, meaning representing the whole country, I'm going to talk about another effort called Project KEEP, which I'm very fond of and which we implemented in Maryland, and I think has some kernels for you here in Texas. And then I'm going to spend a little time talking about shared family care, which is sort of a future-oriented innovation. And I say it's future-oriented even though we ran a program for about 10 years in California, and actually the Texas Baptist Children's Home has had such a program for many years. So that's basically the menu for today. So background, we know that, I don't have a screen up here, so I'm going to be looking backwards a little bit. We know that the placement moves are common. They have been for quite some time. Many children move 3 or more times. And what's really, I think, probably the most interesting study is the study by Newton and colleagues in San Diego, where they looked at kids who didn't have behavior problems, who came into foster care, and they followed them for 6 years, and they looked to see how many placement moves they had. And the ones that had more placement moves ended up with many more behavior problems. And what's interesting about that is it sort of unties the old knot about do kids move because they have behavior problems or do kids get behavior problems because they move? And in this case, by starting with kids who didn't have behavior problems and watching them move and seeing the behavior problems develop, they added a significant amount to what we know. So it certainly is both of those things, but it just clearly identifies how the negative effects on children of placement moves. The challenge that we have here is to reduce our placement moves. That's a challenge all across the country. There are national standards about placement moves, and the reason to do that is because not only are they costly, there's a very nice paper that's recently come out about what it really takes to move a child from one place to another and how much casework and judicial work and all that is involved, but also, of course, they're developmentally unfortunate for kids, as I just described. So one of the things that we worked on, a colleague of mine, Chris Lloyd, who was a student then, is now at Arkansas, was to look at a group of kids who were between 2 and 14 who were in foster care across the United States. We had 92 different jurisdictions sampled, and to try to understand why they moved. And one of the things that we did is to break them down and compare children who had emotional behavior disorders, which may not be exactly the term that you use here, but it's a term that we selected as a kind of a common one. And it basically meant that they had a child behavior checklist score that put them in the clinical range, and those who were not, okay? Now, some of you are going to say, well, every kid that we know is emotionally behavior disordered. That's not really the case. We do have to distinguish between those. There's a wide range of kids coming into foster care, and what we did see in this study, and I won't go into great detail about the methodology, is that there are different trajectories with regard to placement moves and different risks for kids who start with emotional behavior disorders and those who do not. And both of them are at risk of placement moves. The risks are somewhat different, and it's the kind of research that at least begins to spell out, I think, a few practice implications that we can use after we have identified what are the pre-existing behavior problems that children have through an intake assessment, basically. So we had a sample of kids in substitute care at baseline. They were in out-of-home care. Some had high child behavior checklist scores on their internalizing or externalizing subscales. They were in the clinical level. And so the population, we had more that did not have evidence emotional behavior disorders in the blue group than we had in the red group. But the groups are reasonably split. And we had some kids who had 4 or more, trying to figure out what that last one is. Okay, so we split the EBD group with those who had fewer than 4 placements and more than 4 placements. So that's how we looked at them. And we did some regressions to see whether we could predict how much kids would move over time and what explained those movements. We followed them for 6 years. What we found out was that children with emotional behavior disorders were 2.5 times as likely as their non-emotionally behavior disordered peers. So that's probably not a surprising finding, but it does suggest that we do need to serve kids slightly differently if we're really going to try to equalize those risks. And that there were a couple of factors that were really important. One of them is that if the kids with emotional behavior disorders were depressed at the time that they came into care, and if they were not residing with a sibling group, they were much more likely to have subsequent placement moves. So it speaks to us as clinicians about what are we doing to assess depression, what are we doing to really figure out how kids are responding to the fact that they are separated from their siblings. Age mattered somewhat, special needs mattered somewhat, and hopelessness about reunification mattered somewhat. For the kids who did not start out emotionally and behaviorally disordered, only age mattered. The older you are, the more likely you are to have placement moves. But we couldn't really figure out any real predictive, we couldn't do any real predictive analytics in terms of explaining these outcomes. Although there are a few things that we looked at. Males, as some of us talked about at lunchtime, were a little less likely to experience movements, a little less drama from some of the males, maybe. And then also having psychological trauma, a criminal court appearance, or having special needs approach statistical significance. But for the non-EBD kids, it was principally their age that made the difference. So it is the case that kids with emotional behavior disorders are more difficult to keep in place and to help to stabilize their placements. If we can get some traction with regard to understanding their depression and what their reaction is, what their thinking is about whether or not they're going to be able to go home and when they're going to be able to go home. This turns out to be a very important factor in a number of other child welfare equations. Understanding whether they're ambivalent about going home, whether they feel urgency of going home, or whether they don't care to go home is a very important diagnostic category. And these are the things that we can try to make sure that we're building into our clinical work. So that's just one study about placement moves and some of the things we can do sort of on an individual basis. But what I'd also like to do now is talk briefly about 2 programs that I think could have a more systematic and more programmatic impact on placement stability. And one is called KEEP. It's a creation of Patty Chamberlain primarily at Oregon Social Learning Center. You'll probably recognize Patty's name. She also developed multidimensional treatment foster care for the most part. KEEP is what she would call MTFC Light. And the other is shared family care. And what do they have in common? They both increase positive responsive parenting. They both endeavor to provide feedback to parents in real time. And they integrate best parenting practices and support. So they're not just evidence-based parenting programs, but they also have a strong and somewhat enduring support element. So KEEP. KEEP, as I mentioned, was developed by Patty Chamberlain. They serve foster kinship care kids in common. So I know that one of the things that the Texas waiver has in it is some possibility of expanding the number of slots for multidimensional treatment foster care, but for those of you who know that evidence-based practice, you'll understand that it's one child at a time. And it's almost always new foster parents who are specifically trained, not new that they've never had any experience, but they are specifically trained to be multidimensional treatment foster care parents. KEEP, on the other hand, can work with existing foster parents who already have children in their care. It works with relatives as well as non-relative foster care. And there are a number of papers which you can get from the authors, or from the organizers, the references in the back of this. And they've got a pretty good trajectory now, about 10 years of implementation of KEEP. It was originally implemented in San Diego. There are subsequent studies in the UK. New York City has a big KEEP implementation going on right now. And we were fortunate enough to implement this in Maryland. So the basic idea is that if you can reduce behavior problems, you can reduce the risk of placement disruption. And every time you reduce a placement, you also reduce the sense of alienation and loss and frustration that kids have. Pretty simple model, which any of you could have come up with. So what is KEEP? KEEP is a multi-family group. So what's different about KEEP and other foster parent training is that most foster parent training occurs before foster parents become foster parents. So you're getting trained to be a foster parent rather than being trained while you're a foster parent. So KEEP is meets once a week, about 90-minute long sessions. There's usually 2 facilitators. There's some food and childcare provided to make it practical. There's practice every week. And one of the unique things about it is that Patty Chamberlain took her parent daily report, which is where you call the parent every day in multidimensional treatment foster care, to go through a list of problem behaviors they're having, and you keep track of those. So there's 31 problems that you could possibly have. Of course, there are many more than that, but there's 31 on their list. You don't want to have the foster parents on the phone all day. And then you keep track of that, and you use that information for the next parenting group. So it's not all what the curriculum is. It's if you've got a bunch of parents who are struggling with the same thing, then you modify the curriculum to address their needs. So it's really the parent weekly report. If you miss a session, you get home visits. So they try to make sure everybody's doing this well. And there's a major focus on building group support. So these families also become supportive of each other. Just as an example, since this is almost Thanksgiving, when we were doing this implementation in Maryland, the groups were on Wednesday night. Parents agreed that they didn't want to do the group on Wednesday night. So they came in with the workers on Saturday into the agency to do these groups because they thought it was so important. They wanted to see each other and they wanted each other's support. So this is this is data from Joe Price's study of KEEP in San Diego. And what this shows is the number of prior placements. So on the bottom of this axis, you see all the way up to 20. And what that means is that in general, the more placements that you have had, the more likely it is that you're going to have another placement, right? So that's what that top line is, that every time you have a placement, it increases the likelihood, the prediction that you'll have another placement. The bottom line is the KEEP group. So what they were able to do is to flatten out the likelihood of subsequent placements by this group intervention. And that's those are very exciting findings, and those have been replicated in a number of different places. So we did a group in Maryland, as I mentioned, and these were foster families. Of course, the workers referred them if they were like the most problematic families. They were worried about a disruption. So it wasn't a cross-section of kids in foster care. We got a high-risk group of kids into foster care. I'm not going to take you through all these slides. There's a bit too many. But what I would say is that many of them were placement number at the start of KEEP implementation. 45% of them were in their first placements, some in the second placements, some in the third placements, and the remainder, it's another 10% or so, were in another placement, fourth or higher. We had, over that 6-month period, 2/3 of the families had the children had no placement moves, and 24% had 1 placement move. The thing that we were really excited about is that there is a slide, I'm going to actually move ahead to this slide, that shows the data from San Diego and other places is that if your parent daily report comes in at 8, 9, 10, 11, or 12. So those are the problems that a parent reports about their child on that day, that your likelihood of a subsequent placement or replacement goes up extraordinarily. So you see that sloped line. That's what happens once you get to around 6 reports, but especially when you get up around 8 or more reports. If you're a foster parent and you're only having 4 or 5 problems a day, no big deal. It doesn't really increase your likelihood of placements. But when it gets to a certain critical point, then that placement list goes up. So what we were able to do, in essence, was reduce. So our kids came in with an average of 8 problem behaviors. We were able to reduce the mean down to 6. Doesn't sound like a big difference, but from a clinical standpoint, it makes it a much more manageable difference from parents' perspectives. Okay. So you can see that these are some of the behaviors that were reduced, and we managed to get them down from 8 to 6. And we managed to get more kids into this category of having fewer than 6 behaviors. At the beginning, there were 37%, and then we managed to increase that number to 56%. So these are kids we could predict to have stable placements. So probably enough said about KEEP, but what I really like about KEEP, although it is a packaged intervention that Patty Chamberlain has developed, and she has, actually I probably should go back one slide. I should tell you, so these are some of the findings that so far KEEP has been effective wherever it's been replicated, and there's one replication in Illinois that Sonia Leathers did where they didn't work with Patty. She didn't work with Patty. She just read the materials and created her own version of KEEP. Parents learn the skills and they use the skills. And one of the things I love about it is they videotape the sessions and they talk with the parents and get information from the parents, and they come up with a coefficient that says how positive is this parent towards their child, and how many times do they say something positive versus critical. And when that shifts, you start to see the behavior problems shift. So it's a very easy thing for them to monitor. It's cost effective, and yet at the same time, it's not operating in Maryland anymore because of the fidelity checking, which was a significant burden. But what I do want to say for Texas is that you can certainly talk with Patty about using KEEP and taking on all the things that she would add to it, and she's really, she's extraordinary. But I also think that KEEP is replicable, that you could put the pieces together yourself, and that's certainly a legitimate way to go. So quickly, shared family care. This is an idea that I got when I had a Fulbright to Sweden, where at one point in time, half of the kids in out-of-home care were also living with at least one parent. And at first I thought, well, that's extraordinary. The parent is in foster care with the kid? Could we ever do that in the United States? Well, it turns out when I got back to the US, we were doing that already in a number of places. There was a program in Minnesota where homeless parents were with developmentally disabled children were being housed together, so they were off the street and their kids were supported developmentally. And the whole idea is that an entire family, which is usually the mother and a couple of her children, sometimes they don't bring all the children in at the same time, and it's usually the entire family does usually not include fathers. So it's not technically the entire family, but the nuclear, that group, comes to live in foster homes. Now, some of you would say, how would we ever find foster parents who would take a whole family in? We can't even find foster parents who want to work with birth parents. And what I would say is that never turned out to be really that hard. There are lots of families out there, especially in our churches, who have already nurtured nieces and nephews and grandkids, and they've been involved in supporting people in many different ways for many different years. And to do it in foster care with the support of a great agency was not any great challenge for them. And it's actually not that expensive either, because it ends up being about the cost of specialized or treatment foster care, which I know is a program that you have only in some limited ways, but you know that there's a kind of mid-level rate that seemed to work for this. So these are the things that we see that I would say about shared family care, that the lack of parental monitoring we know is associated with child abuse and neglect, and hosts model monitoring of child and supervising parent-child interactions. Now, one of the great things you may have coming your way is the flexibility to fund things a little differently. One of the reasons why shared family care has not taken off is because under the under Title 4E of the Social Security Act, if you want to claim federal dollars, you can't claim them if the mother and child are still together. You can only use 4B. But if you waiverize this or you use the flexibility that may be coming your way, then you can use you can use resources from 4E because they're basically given to you to use flexibly. Housing is a huge problem. We don't talk that much about it in child welfare, but it is a huge problem, let's put it that way, and it's reduced in this case. And it reduces illegal activity, and it also provides support by families after discharge. So there are lots of different parts to it that we have already kind of manualized and are available. And this program is one that I think is a great in-between for those cases where you think that in-home services might not be enough, but you think that maybe out-of-home care is something that isn't necessary. And if you can find that middle place, find that additional service, what you're going to be looking for in your work is these boundary-spanning interventions where there are cracks, where cases could go on one side or the other, and you're trying to figure that out, and you want interventions that allow you to do both of the things that you want to do. Keep families together in this case, but also monitor a child's well-being. So what these things have, one of the great things about shared family care is it provides timely information about how a family is doing. Sometimes families walk away. They say, I can see that I could never be a parent like this. I could never help my child the way that my child should be helped, and I'm going to relinquish. So we've had some relinquishments, but in most cases it just provides better feedback to the worker and to the parent themselves. They get some feedback from the host about how they're doing as a parent. There are evidence-based intervention opportunities there that this provides support while a child is in care rather than the typical way we do foster parent training, which is before kids are with their foster parents, and that is much less helpful. And I think the other thing is that if we can start to use very practical tools, brief assessments of depression, parent daily report, it would be my goal that every child welfare worker knows the tools, or every child welfare professional knows the tools of using a parent daily report. They know which families they might use them with, how to interpret them, how to help families to avoid crises. So when they start seeing those problem reports going up towards 8, they do something different. They help them more intensively. Those are all pieces, I think, of the kind of innovations that we might look forward to in our field in order to reduce placements. So with that, I thank you for your attention and would be happy to answer any questions. Thank you.